Today, we are covering the ethical principles in nursing, a topic guaranteed to appear on your NCLEX exam. The test will not ask you for simple definitions. Instead, it will give you a clinical scenario and ask you for the best nursing action, which requires you to apply these principles under pressure. The four core principles are autonomy, beneficence, nonmaleficence, and justice. Autonomy is the patient's right to make their own healthcare decisions. Beneficence is the duty to do good and act in the patient's best interest. Nonmaleficence is the duty to do no harm. And justice is the principle of fairness and equality in care. The NCLEX loves to create situations where these principles clash. For example, a competent adult patient with a treatable condition refuses a life-saving blood transfusion based on their religious beliefs. This puts the principle of beneficence, your desire to do good and save their life, in direct conflict with their autonomy, their right to refuse treatment. What is the priority nursing action? The answer will almost always be to respect the patient's autonomy. The exam trap here is choosing an option where the nurse tries to persuade the patient or consult the family to override the patient's wishes. This is paternalism and is the incorrect answer if the patient has decision-making capacity. Your role is to ensure the patient is fully informed, which involves the principle of veracity, or truth-telling. You must explain the risks of their refusal in clear terms, but you must ultimately honor their decision. This also ties into fidelity, which means being faithful to your commitments. You are faithful to the patient by respecting their wishes and faithful to your professional duty by providing the best possible care within the scope of their decision. Let's consider another exam scenario. A patient is prescribed a potent chemotherapy agent that will cause severe nausea and hair loss, but has a high cure rate. Administering the medication upholds beneficence by treating the cancer, but it also causes harm, the side effects. This is a classic test of your understanding of nonmaleficence. The key is that the potential for good outweighs the unavoidable harm. The trick wording on the exam might present an option that focuses solely on avoiding the harm, like withholding the medication, which would be incorrect. Justice is often tested in the context of resource allocation. Imagine an emergency department with only one ventilator available during a mass casualty event. You have multiple patients in respiratory distress. How do you decide who gets it? Justice requires that this decision be made based on a fair and equitable system, like triage protocols, not on the patient's social status, age, or ability to pay. An exam question might tempt you with an emotionally compelling but ethically unjust choice. Remember this simple phrase to keep things straight. Their choice, your duty. Do good, no harm, be fair. This covers it all. Autonomy is their choice. Fidelity is your duty to honor it. Beneficence is to do good. Nonmaleficence is to do no harm. And justice is to be fair. Master the application of these principles in conflict, and you will be prepared for any ethical dilemma the NCLEX throws at you.